within the program materials that you received, there was a brief overview of who I am and what I'm doing and where I've been to some extent. I just wanted to give you a very brief overview of why I'm so adamant about hiring the right people and looking at customer service. I started my first blending clinic in 1975, and this clinic was part of a hospital program. My background is in nursing. I'm a nurse practitioner, and then I went and got my MBA so I could learn a little bit more of the business model. And one of the key components, I was establishing this clinic in a small rural part of Massachusetts. So, because I lived in Rhode Island, worked in Massachusetts. So, although I'm living in North Carolina now, that's why I don't have the southern drawl. So, I found that it was very, very important to hire the right people to carry my vision and mission that the hospital told me I was supposed to have through this clinic monitoring. I hope at the end of our session you'll all have that same vision and hopefully be able to provide you with some tools to do that. So as part of the disclosure information, the slide's there and you all have copies of it, so I'm not going to read the whole thing for you. But I do want to talk a little bit about the objectives and what I hope you'll be able to understand after we get through this. And the biggest thing is that there are certain hiring techniques that I feel are invaluable when looking at what is your staff and what are they doing. And I think it's important to be able to look at appropriate candidates to get the job done, but it's also important to look at what qualifications you should be looking for and what types of standards you need to develop for customer service. Because customer service, in my opinion, drives a positive patient experience. And so we need to make sure that the employees we have and that we hire are focused in on customer service and that patient experience so that they become the best possible team of providers and caregivers in your area. And once you have those standards established, then hopefully you'll be able to develop some outcomes so that you'll be able to measure the amount of the experience that your patients had in your clinic. How positive was it or how negative was it? And so then you can use that information to further enhance the services for the day after you do the satisfaction surveys, etc. So that's what we're going to be talking about this afternoon. One of the key things that's important is looking at your staff mix. What positions are you going to be hiring for? How much do you need? How many people are going to be in those positions? What does your State Practice Act advise? And where do you start? For my own information, how many of you are already in a clinic setting and have hired your staff and you're ready to go? So the majority of you. Maybe this might be an ideal opportunity then to afford your staff an opportunity to represent themselves and to say to them, you know, we're really now committed to a very positive patient experience. So we're going to go through an exercise to see if you came and applied for a job, if you would meet the criteria that's now part of our vision and mission for maintaining a positive patient experience and for customer service. And so in order for us to do that, we're going to go through an interview process to see if I would rehire you and to provide you with some opportunities where you need some further education, where you might be able to enhance your current vision of what customer service is and what a positive patient experience is. Have any of you tried that? Re-interviewing your own staff to see where they're at, what they're doing, and affording them opportunities to look at where they should be? Well, I have done it in the past, and I can't begin to tell you how much of a positive experience it was. When they knew that we were looking, and usually it was myself and my medical director and the practice manager, when they knew that we were looking at them and what they were doing, all of a sudden there was this enthusiasm to share how great they were and how they needed to continue within our clinic employment. So I just share that with you because I think it helps. It helps. So most of you, I'm sure, have already determined your staff mix. So this nurse droid, then, is probably not on your list of things. And the reason that I share this with you is in doing research for this project, I was looking around to see what other countries were doing. And when I saw this, I said, oh, I got to put that slide in the presentation. We don't have any urgent care nurse droids yet. But we may have some in the future. I'm just amazed that in the Japanese and Korean environment, they chose just a female droid, and there's no male nurse droid. I didn't think that was too spivvy coming from the female species of the gender, but that's okay. So maybe in the future we'll have nurse droids. Or you may have some now who are like robots when they take care of patients. And there's no positive feeling, there's no view about what customer service is. So although your nurse droids might not look like this, you may be paying them a lot of money to move around your clinics. Does anybody have any nurse droids that aren't quite robotic but function that way? A couple of you do. A couple of you do. And then here's the provider of the future. This is a RIP Vita, one of the latest hospital robot prototypes. Now this is specifically for InTouch Health. This is telemedicine. So this robot's about 5 feet tall, and it goes down the corridor to the patient's bedside, and the provider at home or in another location can speak directly with the patient. Now this requires that the provider have an excellent communication tool because he's not right there with the patient. And so it still, though, reeks of the robot drone. And so we may find that in some of our urgent care centers, we may have some robot provider drones in our staff. Does anybody here have any? They're very regimented. They're not their bedside manner leaves a little bit to be desired, and they function on one level. And so their patient experience can be very negative. And here again, they chose a male for the doctor, and I would have problems with that. I think that the female model would do just as well. In fact, maybe a little bit better. But anyway. Well, looking at the patient experience, where did it come from? How come all of a sudden we're talking about it? Well, you've heard all about this morning, I'm sure. But I found this quote from W.J. Mayo in 1910. And I want to take time to read it because I think it's very, very important on how this is not new. We've seen this in the past. Mayo said, "The best interest of the patient is the only interest to be considered, and in order that the sick may have the benefit of advancing knowledge, union of forces is necessary. It has become necessary to develop medicine as a cooperative science." I don't know where some markets lost the code, the message, etc. But I think today what we would like to really get is we are a team of multidisciplinary providers that care for the patients that walk into our urgent care center. So we need to function as a team. We should think like a team. And so whenever we're considering training, education, it should be a team effort. It should be a team effort. And this isn't new. I'm sure it was even before 1910, but this was the first quote that I found that specifically referenced it. So what does this mean for you then? Why are we going to discuss the hiring, the interviewing techniques and stuff of a patient experience? Because, people, we need to know how to hire the right people, and we need to make sure that when we're doing this, they're focused in on our best goals for a positive patient experience, because we're moving from a volume-oriented medical society to a value-oriented medical society. Well, Donnelly, what does that really mean? It means that your outcomes will drive your reimbursement. So before, the more people you saw, the more money you might have made. Now, you can see as many people as you want, but if your outcomes don't meet standard, then you're not going to be reimbursed. And that's already started with Medicare and Medicaid patients, and I'm sure you may have already seen some of this in your own urgent care centers. Well, if you have some nurse drones or some robotic physicians, you may have opportunity to clean house and to hire, because according to the April 30th publication, Healthcare Insights and Trends, Jason Lovelace said in his article that 34% of healthcare workers plan to look for new jobs in 2013. 34%. So there must be a lot of people out there who are considering placing themselves in a different work environment. And so I think it's important for us, if you need to clean house, to look for the best of the best. So there's a couple of things that I'm hoping we can just briefly go over, since most of you already have staff, and that is define the techniques for hiring and candidate selection. You may think that this is very basic, but people, I find that it's always good to go back and look at the beginning and see what we can do better the next time around. So as you reevaluate your staff and do some gardening, and I told one of my supervisors once, we really have to do some gardening in this clinic. She says, what are you talking about? There's cement all around us. I said, well, I'd really like to weed out some of the drones that are currently working for us and get some roses in there, maybe a few lilacs, and some strong bamboo that'll stand up straight and tall for us. So I think it's time to do some gardening, and when you're doing some gardening, make sure we have the right techniques. We need to look at your staff mix again. Consider who you have and who you need to hire. So how are you going to determine who you need to hire? Well, I think you need to look at your State Practice Act. The State Practice Act was formed through the legislators to ensure patient safety, that they identified within your particular state the right qualifications, education, competencies that were needed under the particular licensure requirements of people in your state. This impacted more than ever the amount of nurses, MAs, rad techs that were hired by clinics. How many of you are hospital-based urgent care centers? Quite a few of you. Hospital-based urgent care centers, in my experience, say the only staff person that a physician really should interact with is a registered nurse. Well, their scope of practice is such that that's what they felt was really important. So we're looking at hiring a registered nurse at $56,000 to $80,000, okay, rather than a medical tech who can do the same things that the registered nurse is going to be doing, like drawing blood and doing urine drug screens and helping with sutures and doing an appraisal for an upper respiratory for the doctor by taking vital signs. There's no brain surgery involved. So, do we need to have those registered nurses in our staffing mix the way we used to? Only if your blended clinic is doing a lot of health and wellness and you need those registered nurses for coaching, because they do an exceptional job in that area, okay? But your Practice Act, if it allows for MAs to do immunizations, and if it allows for MAs in your state to take x-rays, you have a wonderful opportunity to reevaluate your staff mix. If it doesn't, then you may need to consider licensed practical nurses. They're out there, and they are working very, very hard to maintain employment, as many hospitals are slowly changing their staff mix and getting rid of them. So I bring this up because I think it's really important. In today's environment where we're all trying to save expenses and increase our revenue, staffing is a big issue. So we're going to define your staff mix. What professions do you need to hire according to your State Practice Act? Who does what? And what competencies are you going to need in order to be able to have these people provide the best possible services for the patient's experience? So in order to do that, you really need to re-look at your job descriptions, your jobs, your roles, and your tasks. How many of you specifically list tasks for your staff in your job descriptions? A couple of you, but not many. The reason I bring that up is because I think it's so very important to have in your job description the respective roles and to develop task lists. So before you hire somebody, you should say to them, this is the job description. These are the tasks that you'll be doing. These are the competencies that I'm going to be looking for, and this is how I'm going to evaluate your performance. And this is how often I'll be evaluating your performance, not just once a year. By the end of the year, your patient experience could be so negative with these staff people inappropriately caring for people that it's very, very difficult to recoup those lost patients. So it's important to go back and look at this and say, well, are all of our competencies up to date? And then take it a step further. Do you have productivity indicators already established for your staff? Now, what the productivity indicator does is it takes the particular tasks and assigns a time component to that task. And it says, well, if I'm going to do a urine drug screen, then that urine drug screen should take me anywhere from 18 to 22 minutes, and my medical assistant's going to be doing that. If I'm doing an initial evaluation of an elder patient, 55 to 65, my provider is going to probably take a little bit longer, maybe 25 to 30 minutes, as opposed to a well person coming in with an upper respiratory. My provider may only take 10 minutes to totally assess that patient. It's important to differentiate, and the time parameter is important. Why? In an urgent care setting, why is the time it takes to do something so very important? You're trying to process patients through wait time and wait times. Because if they wanted to wait forever in your reception area, they would have gone to the emergency department. They came to the urgent care. Why? It's faster. Why else did they come? Sorry? More affordable. So it's faster, it doesn't cost as much, and you're licensed to provide care. Oh, you're nicer. Licensed and nicer. I like it. You're nicer. Are you sure? How do you know? You think you're nicer. Do they think you're nicer? That's what we need to make sure we understand about our market, right? We want their experience to be positive. Do they look at mortality and morbidity rates? No. Not in my experience. I haven't found too many patients that I've interacted with who said, you know, I don't care for the services at that place. And I said, why? Do they have a high infection rate? Oh, no, they're not nice to me. They're not nice to me. Who wasn't nice to you? That receptionist seemed very angry all the time. The first person they saw when they walked in the door turned them off. So what about the rest of the experience? Isn't going to work. Isn't going to work. So productivity indicators, I think, are very helpful. Very helpful, especially if you have a group of providers that are from the old school. And the old school was, I need to take as much time as I can with this patient because I'm really developing a relationship here and I want to make sure I don't miss anything. That's an old family practice model. Urgent care doesn't have that old family practice model. But you have to do the care that's provided in the urgent care setting so the patient does not feel rushed. They are not there to develop a relationship with you so they can send you a Christmas card. They're there because they don't feel good and they want you to help them, okay? And you can help them in a timely manner, okay? So that's what you need to look at when you're looking at your productivity indicators. And then develop incentive programs as part of your job description. Don't forget, we're still talking about job descriptions here. Why would you put an incentive program in a job description, Donnelly? You know, we don't talk about that too much with the rest of the staff. Why, it's a secret? There shouldn't be any secrets about incentive programs. I firmly believe, and it's been my experience, that you get a team together when everybody gets the same incentives. So if they're in budget, if their volumes are up, if their patient satisfaction scores are above threshold, that's everybody. That's not just one person. So it's important to rethink the old adage that the only people that should get incentives are management, personnel, and providers. I think the billing people who get the bill out are very important because if they didn't send the bill, we wouldn't get paid. And if they send out the bill right, we get the right amount of money back. Okay? We need to identify our performance criteria. So how many of you have customer service components in your current job descriptions and performance evaluations? A couple of you do. A couple of you do. The rest of you need to. The rest of you need to. Reconsider that. And then clear expectations about when you're going to review their job descriptions and their performance. Okay? So in your new search for staff, whether that's internal and you reevaluate who you've got, or whether you get rid of some of the weeds and you decide to go look for people, it's important to research candidates' credentials and backup checks. And then you're set to interview. Are you? Are you set to interview yet? We have a job description, okay? We're sure that our staff mix is established. Are we set to interview? If you're going to interview somebody and you have a job description, what kind of questions are you going to ask? In today's environment, we have to make sure that we address all candidates in a very similar fashion. So I'm submitting to you that what you need is a standardized format for interviewing. And so here's 8 interview questions that I thought were pretty basic, and I'll provide them to you in your slides because if you get rid of the weeds, you may need to hire some people. And I think these are excellent questions to ask people. Might be interesting to see what your current staff would answer to these. Tell me a little bit about yourself. It's always good to get some baseline information. All right. How many of you that have a team of people that you're working with know about each person in the team? A few of you. Okay. I think it's important that if you're part of a team, you should have some common goals, common visions, common strategies. And then it would be interesting to ask people, what interested you in this job? And then in your employees today, I'd ask them, what are 3 or 4 really good strengths that you feel you bring to this clinic? And then what are 3 or 4 weaknesses? And then you can develop a staff enrichment program to address some of those weaknesses. Okay? What are your accomplishments and abilities? How many of you that work in an urgent care center contribute to the community by participating in community development activities or by volunteering for different organizations or participating in different organizations like the Lions Club, the Masons? Yep. What does that say to the community? You care and you're committed. You care and you're committed, okay, by participating in organizations that are purely voluntary. And I think that's important. Be interesting to know how many of your staff are involved in some of those activities, okay? And then, I don't know if you asked this when you hired them, but how do you learn is a very important question. Because if your staff learn best by reading and self-learning, and all you're doing is didactic presentations for 20 or 30 minutes in front of them during a staff meeting, they're missing the boat. So it's really important. And for what kind of boss do you work effectively, and why? They may be working for the wrong boss. And why should I hire you? Why should I hire you? Maybe why should I continue to have you as part of my staff? What do you bring to the team? So these are just common interview questions, and it kind of sets the stage. It sets the stage. And then we get into behavioral interviewing about customer service, critical thinking, teamwork, and management and leadership. So those other two are on another slide. But I put this customer service in here because this is what enhances the patient experience. Tell me about a time in which you went out of your way to please a customer. Now, I've had existing staff and managers take this and turn it around. And at a management monthly meeting, ask the staff each to share how they went out of their way to please a customer. And see how many people can give you an answer. And then ask some of your existing staff, tell me about a time when you were effective in handling a customer complaint that I'm not aware of as the manager. How did you help somebody? And then let's look at how that happened. And then how were you ineffective in handling a customer complaint? And how could we work through that better? Just some components that you can use now with your current staff to say, where are we with this whole customer service component? Critical thinking is a big component in addressing an issue when it immediately comes up so that the patient is not left hanging. And it's been known, and survey shows, that people with good critical thinking techniques and strategies enhance patient experience because they're very quick to pick up an issue, problem, or concern and can address it. They're familiar with the resources that are available, whether it's internally in your urgent care centers or externally in the community. So it's important for your staff to know what's available in the community for resources. What if somebody comes in and you have a very distraught parent who just brought a child in because the local school wanted to have a drug test done? And in some communities now, this is happening more and more. And the parent really doesn't know what to do, where to turn. They don't have a primary care provider. They can't find one. They don't really have too much insurance. So where are they going to go and what are they doing? They don't have an employee assistance program at their place of employment. Okay? It's important for your staff to be able to say, well, you know, we've got some community activities that are out there, community agencies that can help you, and be able to refer them, make the phone call, take that extra step. Okay? So critical thinking skills are really important. You also need the critical thinking skills for a provider, and people look at me and say, Donna Lee, they've already got them. They're doctors. Oh, contraire. They're doctors. They can take care of an illness and a disease, okay? But they may not all be in tuned to what I'm talking about, what's happening in the community around them. So you should really have a well-formulated referral process in your centers, physicians that you will refer to who have positive patient experiences and know what they're doing. Because it won't be any good for your physicians to be absolutely out of this world and you send them to a provider because they needed an orthopedic consult or something, and that orthopod is a schlep. I was being real kind. Not with the type of practice, but the terminology, okay? If his patient experience is really negative, what's the patient going to think of your center for sending them there? Why did you send me there? He was not nice. Unlike you, who are very nice. Well, I sent you there because he's really a great doctor. Nuh-uh. Not acceptable anymore. There are great doctors who are orthopods who are nice, and you should find the different referral physicians that you may need to send your patients to. Look for the ones with positive customer service and positive patient experiences. So if I was going to start now with my new mantra, I'm going to be the best urgent care center with the most positive customer service approach, and my patient experience is going to be outstanding, I have to relook then at all the providers I'm using in my referral pattern. And that takes time, and it takes research. Usually falls on the head of the medical director to move forward with that, okay? But it doesn't necessarily have to just fall on the medical director, because you're a team, right? So maybe the medical director can assign some tasks to writing letters to your current staff, your provider network, to ask them about their patient satisfaction levels and see what comes back through the mail. It's always better to approach a physician by another physician. Why? That's just the way it works. And so we need to just suck it up and say that's just the way it works. So your letters to your providers, your network of physicians who are providing service, should come from your medical director. In an effort to be able to identify for our patients how positive their patient experience is on referral, we're requesting some feedback from you on your patient satisfaction scores. Okay? I think that's important. I think it's really important. And so the rest of these issues, just critical thinking questions that you could use in a staff meeting to enhance what's happening. Team player. I recommend that you all use these when you're talking about in your next monthly meeting. Tell me about a time when you had to coordinate your activities with 3 or more people. Your staff will look at you and say, well, we do that all the time. Do you really? So when you move a patient from one room to another and you find out that it hasn't been appropriately cleaned or the inventory's left, you then go get the right inventories, put it in there, and then speak to the person whose responsibility it was to keep that room clean so you can process your patients appropriately. Little things that not only are you caring for the internal processes within your center, but the external processes as well. Because patient experience is positive when they have all of the necessary equipment, so your wait times will decrease because your patients are moving through in a timely manner. One of the things that I have found that works really well in developing teams is care mapping your processes. By that, what I mean is, if you have, like, admission procedure, care map what has to be done for that patient to go through from admission, through vital signs, and then through treatment and discharge. What rooms they have to go in, who has to touch the patient. And if you're doing specialty care, then I think that you should add those in. So care map the course of a patient who comes in with an upper respiratory infection. Care map the course for the patient that comes in with poison ivy, urticaria or something. Care map the patient that comes in with an eye injury. Care map the patient that comes in complaining of dizziness. Look at your top 10 diagnoses that came in last year choose them, and care map the processes going through to see where that patient needs to be and how you can best care for them. What will that do? That really stops everybody and take a step back to say, well, you know, if we move the patient from this room to this room and establish a little niche here, we would cut out about 5 or 6 minutes in care processes for those patients. How many of you do care maps now? Yeah. Okay, so you're looking at time commitments, fast-track patient through. And so what I'd say to you is, I can make sure I fast-track that patient through if I look at the specific components of care along that track to make sure it's as fast as possible to get the patient in and out. And one of the biggest parameters that I want you to really, really look at is your discharge process, because here you can make or break that patient experience. You can assist a positive outcome by saying to them, did we do everything to help you? Was there anything else you needed? Do you understand what's the matter with you and what you need to do to get better? Okay? Now, usually that's a very formalized process. And for hospital urgent care centers, because you have quality assurance processes throughout, they always say the patient education has to be paramount. So how often do you see patients leaving with a book with all these handouts that they gave them? The wound care, the medication, the next appointment, signs and symptoms of infection. They're not going to read that. I think one of the most telling things I ever saw was we were monitoring parking spaces outside the emergency department, and so we had to sit in a car and take pictures and make sure it was right. And the first few patients, it didn't register, but after 10, I said, oh, there's a problem over here. They'd walk out the door, there was a trash can, then they'd throw the handouts away and just keep going. So I went inside and I said, what are we giving them? Oh, Donnelly, we give them everything. What do you mean you give them everything? Well, you know, all these sheets and stuff. Look at what you're providing, and we're going to talk about that a little bit. Look at what you're providing and make sure you're not giving them books because they're not going to read it. And what you need to do is to tell them something quick and simple so they'll remember it and keep it up here and take it with them. Okay? And then management and leadership. If you are going to evaluate a new candidate for a position of an MA in your urgent care center, would you ask them any of these management and or leadership questions? How many would? A couple. Okay.
I think it's important that you set some type of situation up. You can't just hire by, here's my resume, oh, this looks great. What have you done? A little bit of this, a little bit of that. It's just wrong anymore. It doesn't tell you anything.
Okay, so that looking at doesn't tell you anything about what they may be doing in the work environment. So looking at management and leadership might be important for all employees. All employees. Depends on the situations. Okay. So staff development and training then is an issue, and you should have a structured program for staff development and training. It starts with the orientation process. And in an orientation process, what I found that's worked best is to have all the staff, if you were starting a new center on day one, there for orientation. When you start a new process in your urgent care centers, I urge you to try this. Have all the staff sit in on the new service you're offering. For example, we're seeing many urgent care centers now with the new processes for the health insurance, etc., bringing in some components of primary care. Not all primary care, but some components of primary care. So if you were going to consider doing that, then you would identify what specific components were you offering as a new service. Because in your market, if you found that there were not any primary care providers with any open practices, and patients coming in without a primary care provider can't get into the local primary cares, you may be looking at helping somebody out with blood pressure, diabetes, okay? And so if you're going to do that, I think it's important to identify it as a new service, define it, and then have your staff sit and listen to what the responsibilities are for each member about this new service and how they can best address this new service. And then the most important part, and what frequently asked questions patients may be asking them, and what's the vision and what's your view on the appropriate answers for that, because that's really important. That there's one voice coming out of your urgent care center with one message that's yours, okay? We're looking at clinical monitoring, and as part of your orientation, you do need to make sure that you have the structure in place to define your clinical monitoring, especially if you're going to be doing some new services. So what proficiencies do you all need in your urgent care centers? I just put a few together here because when I started thinking about this, there's a lot that's involved because of the breadth of practice that you may be exposed to. People say, oh, only in the hospital you get all of that. Not only in the hospital do you get all of that. You're going to see more than they're going to see in the emergency room. Most emergency rooms now have processes in place to defer those patients who are just urgent, emergent, and send them to their local urgent care center. So the first thing on my list, and the most important to a positive patient experience in my view, is computer training. If you can't register the patient, if you can't get the data out, if you can't send the bill, what good is it? All right? What good is it? How many of you have EMRs currently? How many of you trained your doctors, and on their time, they took their training sessions and did it so that they could have study periods on their time to really be proficient in documentation for the patient? Yes, hands up. Yes, they did. You know why? Because they were committed and they knew that if they were able to document appropriately, it wouldn't take too much time. There are other clinics that I've worked with where that didn't happen. The doctor said, I don't want it. I'm not going to use it. I'm still writing. And we said, we can't have that because we have to have an EMR. We have to have an EMR because we need to collect the data and be able to monitor the outcomes. And we don't have the staff to do it manually when we have a clinic structure. And this was a person that I was working with, and they had 12 clinics in their system. And you just can't pick one clinic and get the data, okay? It has to be the system-wide data. I'm certainly not going to go to 12 clinics and try to collect all that data. An EMR will do that for you like that if you set it up right. So it's important that computer training be involved in all that. And then some other components. As you expand your services, your lists will be bigger. If you get into diabetes management, if you get into hypertensive management. And how are you going to know? I suggest to you that you look at the specific parameters in your Department of Public Health risk factors for your markets that you service. They'll list for you the common diseases and conditions in your markets, and then you'll know what opportunities you might have to increase the services that you can provide. Okay? And cross-train everybody, everybody. Doctors, MAs, nurses, front staff. I think one of the most important components when you're looking at your front desk people, and one of the biggest issues that we have is to be able to train them to make sure the patient has a positive experience by knowing who to immediately bring to the back for care, and how to monitor the back flow to know when to tell people in their reception area, we've run into a little difficulty, and so there may be a little wait. We're working very hard to care for our patients, and so please be a little patient. Can we get you a glass of water or something? The other thing is make sure they're aware of who they can offer water, coffee, or anything else to, because we just can't all of a sudden go and offer people snacks and stuff depending on why they're there. So they should be trained for that, and it should be in writing, and it should be in a manual, and there should be an established protocol for that. Okay? And then my favorite managing model, and I talked to the group at lunch, was the dyad model. It takes two people to really be able to appropriately manage an urgent care center, looking at the clinical component and the business component. But those two people have to agree and have some commonalities on the mission, vision, and values in the clinic. They can't be, one's over here and doesn't feel that the hours of operation are appropriate because they have to do the staffing model for all the docs, and everybody's screaming that they don't want to come in at 7, they think they should come in at 8, and at 7 o'clock the patients aren't really there. And then we've got another person over here saying, you know, cost analysis for these charges is showing we need to raise our prices, and then we've got somebody else saying our prices are too high now. So hey, we got to get some commonalities here. You have to have the same vision, mission together in order for the patient experience to work under this management model. So here's some physician leader responsibilities. I'm not going to go over all of them, but I think you'll notice on the top of my list is assure quality. Why? To my view, since we're moving into from volume to value, quality ensures value. Quality ensures that if you have a customer service program that's the best in the nation, your patient experience is going to be the best in the nation. And we have some excellent models out there. The Disney model is an excellent model for customer service. And what do? They take every person as one, and they look at caring for that person to make them have the best experience at Disney that's available. And they do some outstanding things there. So we want to take that into the urgent care center and make every patient's experience in our urgent care centers the best. So our physician leader, our medical director, who's in charge of all of our providers, has to be assured that there's that quality, and they have to build the medical group with that culture. So you may have an opportunity to look for some new physician staffing when you reevaluate where you are and what you've got. Okay? You want to encourage teamwork among the physicians. Okay? And, bless you, we need to look at provider activity, productivity, and their activity, the same way we looked at all the other staffing parameters. And then I think the last component is providing physician continuing education, skill building, and encourage clinical care innovation. I think the UCAOA does an excellent job of providing some new techniques to physicians in the urgent care center. Their journal this month focused in on the difference between using adhesives and suturing. And I read it with interest because I use super glue on my husband when he comes in, and we live in the mountains and it's 45 minutes away, and I know it burns and I know it's not appropriate, and I'm not saying to do that. But I was really interested in learning how they were presenting the model so I could show my husband that I'm not going to use super glue anymore. It's against best practice. It didn't go over too well, but anyway, that's the way it went. But I think it's important to look at your professional journals, get those articles, etc., and in the provider meetings discuss what's the latest and greatest that's happening and what's going on, and how you may change some of the clinical practices within the system. Now, the non-physician leader responsibilities. The first one on the top of the list is operating management. Well, what does that really mean? It means making sure that they're aware of all of the operations within the urgent care center. And then the second one is, and that they have the financial stream to support all of those operational components. The easiest way that you can close your urgent care center very early is if your expenses exceed your revenue. Now, that's not mind-boggling. That's just the way it is. If it costs you more than you're making, then you're not going to be open too long. So how can you be assured that it's not costing you more than you're making? Well, cost analysis is something that you should do of all your charges. It'll help your patient experience as well. As you reevaluate, what is it costing you to do business? How can you cut costs and still provide quality services? Okay? So that's within the realm of the non-physician leader. And the last component on the list, I'm not going to go through all of them, but the last component on the list is market share performance. You need to know in your market who's there, who's outshining you, why are they outshining you, and how come their patient volumes seem to be more than what's coming into your clinic. So a market analysis, competitive analysis, I think are really, really important, and that's under the realm of the non-physician leader. Ghost patients and other things are good tools that you can use on those competitive analysis. And then to make sure that we're able to measure our providers in the specific roles and responsibilities we feel are essential to a positive patient experience, I provided you with some slides on the general responsibilities of provider competencies and what I feel are very positive approaches to a patient experience. And the first one is act as the gatekeeper for all patients presenting to the office for treatment and or referral. And this is the one where if you have a provider and a patient comes in and up front you ask them who their primary care provider is, and they say they don't have a primary care provider. So you know that when you're going through. And you evaluate them on assessment and their blood pressure is extremely high. And you ask them if they've ever been told they have high blood pressure, and they say no. Say, well, let's look at some additional components. How about if we refer you to a primary care provider and they say there aren't any in this area where I live, they have all closed practices. So what are you going to do? I have one vote for treatment. She doesn't have to, but she will. What are you going to do? You're going to send him to the emergency department? It's the right thing to do. Right. But if it's not 200 over 110,
then we're going to refer them out to private, then we're going to send them on to a primary care.
she's going to hope that she can get an appointment through one of her doctors for a primary care physician who has a closed practice and maybe take care of that. I know, yeah. You have primary care docs all over the world in Naples, Florida, but that may not necessarily be what's happening in the rest of the world.
Regardless, the answer would be we would treat them.
They would treat them. Would the rest of you treat? So I've got, she's not going to treat them. So what are you going to do with them? Okay, okay. So you're not just abandoning them. You're coming back tomorrow. We're going to repeat the blood pressure. It's a little high. Going to charge them for that visit? No charge for that visit, no follow-up visit. Okay. So you're evaluating the course, and if after 3 or 4 visits we can't get that blood pressure down, and I think this is what you're all going to be faced in the very near future, and that's why I bring it up. You're going to become the gatekeepers because there aren't enough primary care physicians out there to take care of these issues. And so I want you to think about maintaining that positive patient experience. What are you going to do? What are you going to put in place now before it happens to you in 3 or 4 months down the road? Think about that because it'll definitely affect it. And putting it in your provider competencies to ensure that they act as that gatekeeper for that patient, I think is really important. Because the provider should be responsible for all medical aspects of care in the clinic. This says office, and I apologize. The lady that typed this for me likes office better than urgent care center. She has a primary care doc. And then maintain patient satisfaction survey scores at above threshold. Who sets the threshold? You guys do. That's part of your quality program, your benchmarks, okay? And say you have a score that you're using, 1 being not really meeting expectations and 5 being outstanding. If you were going to set a threshold for your providers, where would it be? 4? Any other? They want it to be a 5. The best that it can be. You want it to be a 5. I put them at 4.5 to 5 because I expect outstanding patient satisfaction that sets the tone, that establishes the culture, that says to them, I want you to be better. I want you to be outstanding. And so that's our goal. And how close can they get to it? How close can they get to it? We want to make sure that they contribute to the team by coming to meetings and demonstrate a willingness to treat urgent emergent cases when they occur. Not say, tell them to come back tomorrow because, or have them wait a little while because I'm going to lunch. Have them wait a little while because I'm going to lunch. And it's important for them to assume, the provider assumes a leadership role in the clinic when the medical director isn't there. They should be on the same page. They should be able to cover the standards, and that's important. And then communication. We keep talking about that. Communication is essential. It's absolutely essential. And then marketing. Now, depending on the services within your clinic will depend on whether your providers are interacting with employers or they're just interacting with the people living in the community. Some urgent care centers offer occupational health services to employers in their market. And so this is geared towards that market, where you're dealing with employers and you're providing some services to them, like pre-placement exams, like injury care, like substance abuse testing. Not all urgent care centers are situated in markets where they can provide this because there's just not anything there. They're in a small community and it's basic population they're caring for. Others are situated in areas where they may be near a lot of firemen and police departments, and so they can provide this type of service to firemen and police prior to hire exams, ongoing annual physicals. The employer-related services, if you have them in your market, bring in excellent revenue stream. Excellent, because they're paid for by the employers. Now, the one thing I'm seeing some employers do today is contracting with urgent care centers to provide what they're calling episodic care. Has anybody got any direct employer contracts, non-insurance, for episodic care here today? This is a practice where you're contracting with the employer, no insurance, just direct pay on an annualized process, and the employees come to you for their urgent care visits, sick call, okay, not primary care now, sick call, it's called episodic care. Excellent revenue stream, excellent. No insurance involved. You get paid so much per month by the employer, depending on how many employees he has. I anticipate, and there are some employers who have done this as well, that they're doing that for primary care as well. And the contract amount is identified per employee for a specific dollar amount per year. And the patient experience that those employees had initially is what drove the employer to have that contracted agreement with the urgent care centers. Works very, very well. Okay. Quality assurance. Actively participate in a QA program, and that's important. They have to define what they feel is best practice. Okay? And maintaining quality standards, everybody should be looking at best practice. Best practice drives positive experiences. Now, what should the standards be for customer service? My goodness, we've talked about it long enough. Well, I think we need to make sure we're embracing a patient-driven mentality. Okay? It's what the patient wants. So we have to look at the patient needs. We need to assess every patient that comes in. That's why I said when you were looking at the different treatments that you have, you need to look at what are the needs of all the patients as they come through your urgent care center. The needs of a pediatric patient are going to be different than the needs of an old gerontology patient like me who's coming through and wanting some assistance with headaches or whatever. Okay? So you need to assess every patient's need when you're looking at customer service and train the staff appropriately, because the way you treat a pediatric patient and their parent and the way you treat an elder are very different in your approach, in your attitude, okay, in your outcomes that you're hoping to attain. So you need to remember that. Some clinics have made sure that they look at every patient by having a comment form that on the discharge process the patient is given to make sure that they were totally satisfied with the care and the outcomes that they have. They color the form by having the different providers pick a color. And when that provider is on, that's the color form that's handed out. And it's a 3x5 card. Now, it's not a patient satisfaction survey, it's a patient comment. Could you please write a statement about how you felt about the care that was provided to you today? Can you please provide a statement about your patient experience? And would you come back? And you don't need to sign it, okay? And just drop it in the lockbox. And then those are reviewed, and those should be posted for your staff, looked at it at your monthly meetings, because that tells them what they need to work on. Now, post-visit communication is one thing that I've seen a lot of urgent care centers now do to assess the patient experience. Please, if you're going to make any phone calls, make sure you have a positive, friendly voice on the other end, especially if they have to leave a voicemail message. And these should be scripted. So the patient, you know you cared enough to call them back. I think one of the models that we've seen that has worked extremely well are your ambulatory surgery centers, where they call every patient back, and if they can't get them, they keep trying until they get them. How was your experience? Did you get everything you needed? Do you know when your next appointment is? Did you get your prescriptions filled? Did you need anything else? Okay, very, very positive. So I would suggest that you all consider doing that. It's certainly not going to be a doctor that's calling because you can't afford it, but that MA could do that. Excellent role. But they need to be scripted, and they need to understand what they're doing, okay? And then I think it's important on that post-communication to thank the patient for coming into your urgent care center. Now, clinic access is a big issue, and the reason it's put here is because when I submitted my slides, it was out of context, so I apologize, but it should have been in the beginning. Anyway, we want to make sure that the patient experience isn't upset by not being able to park, by falling on the sidewalk, they couldn't find the door, so they went into the back storage area. Patient access is important, very, very important. So we need to make sure that we eliminate common barriers. Your reception area, and we know we don't call it a waiting area, because if you call it a waiting area, what do patients expect to do? You got it. So we're going to call it a reception area, and we're going to greet people. I went recently into a community bank, excuse me, and I was greeted by the teller. Now, this is a distance from here to there. Hi there. This is in North Carolina. Hi there. I said, hello. Do I know you? No, but we're so happy you came to our bank today. Oh, okay. That's the first time I've seen that approach. I'm not saying that the receptionist should do that, but greeting appropriately would be good. Excuse me. Okay. Excuse me. So we want to eliminate common access barriers. And also look at your reception area and make it look nice, because you're all nice. Make it look nice. Sometimes I'll walk into them when I have to do some reviews and they look like a pit. So it's my view that the receptionist treats that reception area like her own home, or better, and keeps it clean. Let somebody in the back know, hey, you know, there's cups over here and all that jazz. We need to clean it up, okay? And, excuse me, we want to minimize waiting time. So prevent the exam room shuffle. Let the people in the front know about unexpected delays, okay? What else can you do other than the care mapping that we've already talked about, the productivity monitors that we've talked about, getting the right people in here? What can we do to minimize wait times?
We can tell doctors what's in front of them, what's coming up.
So we have some MAs I've seen who are traffic cops, and so they'll help the physician come back to reality and realize that there may be 20 patients waiting for him or her. Excellent. What else? So anticipate what the physician's needs might be, so that if we see that someone's coming in and waiting in the reception area with a laceration, you could already set up a process to evaluate the wound appropriately. Or if you see someone sitting in the reception area with a bandage over their eye, we know that there's going to be some processes in place to evaluate the eye, maybe get the slit lamp ready or whatever. Anything else?
People will already fill out, someone will help them fill out the paperwork, they'll already take them to the back of the surgery.
So the comment is they'll help them fill out the paperwork, they'll take them to the back when they're doing procedures and put them in the procedure room. What else? Minimize wait times. So the x-ray is done before the physician may see the patient. What does that require in most urgent care centers? Well, the order for the physician, well, not necessarily. See, if you'd establish a protocol, then you can then have the order, because it's by protocol, so that in certain instances where there are certain symptoms and signs prevalent and evaluated, then you can have an x-ray done. Okay? That's an excellent, thank you, that's an excellent way to decrease wait time. Decrease wait time. And I think what you could do is you probably could find even more ways if you ask your staff at the next meeting that you have with them, hey, how can we really decrease wait times? Most urgent care centers, 67% of them, their wait time is less than 15 minutes. So this isn't a big problem. But you can always be what? You can always be better. You can always be better. You can always be faster, right? Our goal is to make sure that it's that positive experience. The caregiver's role in customer service is communication. You need to function as a communicator, an ongoing resource person, and we're going to only give them what's pertinent in written information. And we're going to, yes? I can't hear you, wait a minute. No, that's for walk-ins. That was through the benchmarking survey done by the UCAOA. Excuse me? No, the wait time is how long it takes from the patient, excuse me, when they get them in the door to when they're taken in the back. Reception time, okay, yeah. I'm sorry, I can't.
How many of us fall into that 15 minutes? I'm just asking if you can ask them.
Oh, sure. How many of you have less than a 15-minute reception wait time? 1, 2, 3, 4, 5. For 15 minutes from the time they come in to the time they're registered to get ready to go to the back. Yes. Yeah. A comment here was it depends on the time of day. I think the survey was taken in the aggregate, all days of the week. Don't forget now, most urgent care centers are open how many days a week? And how many days a week are you really, really pumping first thing? 5, certain markets 5, and some there are peaks and valleys. And this was taken in the total aggregate. Okay? Like on a Saturday morning in a little market where there's not much activity, the wait time might be 20 seconds. That's added in and aggregated out. Okay? Now, the same thing is done when you look at emergency room wait times. And they are still up there in anywhere from 3 to 8 hours.
We might run 3 hours in emergency rooms overnight.
Overnight? Wow. Okay.
Only in season.
Okay, when the snowbirds are down. So we need to train. Train your staff on patient expectations, how to answer the phone, how to greet patients entering the facility, how to communicate, privacy and financial policies. Okay? I'm not going to go through the whole list. You guys can read it just as well as I typed it. But I think it's important to get that in there. And then the bedside manner. This is the biggest cited reason primarily for patient dissatisfaction issues, the bedside manner. Patients often are unable to discern medical care quality. We talked about they don't know about morbidity and mortality. What are they thinking about? How does the provider talk to me? Some of them, when I've been at the other end, I'll say to them, well, what did you think of your experience? And they'll say to me, I couldn't figure out who was who. They all were dressed the same. Well, what do you mean, who was who? Well, who was the doctor? Who was the nurse? Who was the receptionist? I said, well, what difference did it make? Well, I want to make sure I'm listening to the right person. All right? I want to make sure I'm listening to the right person. So what does that mean? It's important that your providers and your staff introduce themselves and tell them who they are and what they're going to do and why they're going to do it. So you need to implement a system to measure the patient experience. We talked about comment cards. We talked about telephone calls. Then there's the paper survey. And now there's the internet survey. So if you get every patient that comes in, if you get every patient who has an email, their email, and then you refer them to SurveyMonkey, there's an excellent way of getting their feedback, or sending them an email with a brief survey on it, or referring them to your urgent care website to complete a form. How many of you have websites? Everybody has a website. Good. So that might be an easy fix for you to do. Refer every patient that comes in and set up a process so you give them a little number and tell them this is your number, this is how you can get into the survey on our website, because patient access now, you need a patient portal. How many of you have patient portals? So put your survey on the patient portal at the end and you'll get an easy way to measure it. This is a sample. Yes? Only if they're prepared to respond? Only if you're going to respond to the surveys is it worth it, and that's so true. That's like gathering a lot of statistics and then just putting them in a box. Good or bad, yes. And I think it's important to respond directly to the patient as well as put that in a report to your staff and go over those surveys monthly. Thank you. That's an excellent point. This is a sample of competency for customer service, and it talks about team members and team leaders. And I put this in here so you'll have a sample of one. And so what's a patient service team? Well, there are 7 components. And the first one is staff commitment. Your staff has to agree that this is important. Because if it isn't, my grandfather had a term, he was Sicilian. He'd go like this, which means it's not worth anything, don't even bother. And those weeds really need to be removed from the garden. Staff commitment's important. Training, promoting the right attitude, establishing standards, etc. So we're going to go over them. Value-oriented staff committed who are friendly. Team and system focused. Now, if you have 10, 5, 14 urgent care centers, I recommend you consider rotating staff through, because it's one system, okay? There may be different treatment parameters within the different markets. Like here you may have more of a family orientation. Over here you might have more of a service elderly population. But it's important that they all rotate through so they don't forget what they're supposed to be doing. Okay? And that becomes more of a team approach then, that I'm on South Street and you're on Friendship Street, and we don't have a clue what you're doing, and you don't have a clue what we're doing, and I think that's wrong. We want them to care.
Happens among a couple of ours, so they're there, we're here, they don't integrate enough, and when they finally do,
They don't care. The comment is if they don't integrate enough, then they don't really care what's happening at the other centers. I think in order to be a team, you need to move. You have to make sure that the people have the competencies to function at each of the different sites, though. So we can train effectively. I think one of the main things is to write down infrastructure in an urgent care center starts with manuals, You can do online manuals, but it starts with manuals. It starts with the task list, the job descriptions, the customer service focused manual, the training programs, a final exam. It's all there. Oh, promote the right attitude, okay? And it has to start where? At the top. At the top. It starts at the top, and then it goes through all of this stuff. This talks about listening, etc. You need to establish some standards that say these are the scripts we in our urgent care center are going to use, okay? And work with the program managers to make sure that you establish and measure quantifiable performance standards for everybody. Motivate and reinforce. If you were going to do numeric standards, what scale would you commonly use? 1 through 10, 1 through 20? Most analysis will say 1 through 5 does it, with 1 being poor and 5 being outstanding. Okay, so you don't have to get numbers that go too high. Creative incentives, we talked about them, monetary or tangible rewards. You can use a simple coffee break, greatness, or a chit to go to the local gas station for gas. Doesn't necessarily have to be money. It can be an American Express check. Should be something, though, that's recognized as valuable by the staff. It doesn't do any good to give somebody a dozen donuts who's on Weight Watchers. You know, it just doesn't work. Build a patient service team, define the common measures. The staff needs to work with you to do this. So, we said employees had to be motivated. They need to be coached. When someone does something wrong, they should be privately coached. When someone does something right, they should be publicly provided with the positiveness of it. Okay? So in order to have your outcomes to monitor patient experience, you need to be proactive. So what's the first thing you have to have? Before you can have an outcome, you have to have a what? A standard. This is the standard. Then this is the performance measurement. And then that drives, the performance measurements drive your outcomes. Okay? Now, there are 14 steps to optimal patient encounters, but we've said all these already. Warm and sincere introduction. We talked about people greeting patients. And then active listening skills. This is just common, everyday, good interaction and communication. Okay? Repeat key questions so that you're sure you got the patient understands what you're saying. Explain why you're doing things. Avoid negative words. This is something that sometimes is difficult from practitioners. So I can remember I was recently hospitalized, I had pneumonia, and I said to the doctor, you know, I just can't seem to get any energy back. And he said to me, well, in the olden days, people died of this. Gee, thanks. And so how can I get some energy back? Well, just think positive, Donnelly. Gee, thanks. So let's avoid negative words. I've heard of providers saying, you know, to go get the script and take this medicine. It'll probably take 3 or 4 days, but then you should start to feel better. Instead of saying, I want you to get this prescription because within 3 to 4 days you're going to feel much better. See the difference? They don't hear what they're saying sometimes. And it's not only providers. It's the front desk. Oh, we've got a heavy backlog here. You better sit over there and get comfortable. Instead of...
I said surgery room. You said procedure.
Surgery room procedure.
The surgery room there. Surgery, why am I going to the surgery room?
Right. It's important to explain to the patients why they're going where they're going. Okay. Emphasize with gestures and tones. Well, I'm half Sicilian and half Cherokee Indian, so eventually you're going to get the signals, whether it's through smoke or hand. But, you know, I think the gestures and the tones are important. Summarize the problem in the treatment in your discharge component. Now, the doctor found this, this, and this. He wants you to do this, this, and this, and you're going to go get this prescription or whatever. Okay? And then, I think it's important, and many providers now are shaking a patient's hand when they leave. And a patient got all upset because the doctor went in and shook the hand, then went near the door, put that stuff on, made sure he wiped his hands, and left. I recommend they do that after they leave the room on the outside so the patient doesn't think that they're contaminated in some way, shape, or form. Okay, the golden minute. The first 30 seconds when a patient comes in sets their theme for the visit. The last 30 seconds can be really helpful in making sure that they're very, very pleased about their visit. That discharge process is as important, if not more important, than the first 30. All right, questions? You're all so tired, you just... Well, from a speaker's perspective, did this help? Some yes.
I thought you did great.
Thank you.
I didn't know that's on this one, so I think you're really better than the last.
Thank you. Anybody else get any positive vibes out of this? Was it helpful? You don't want somebody to sit for an hour and a half and then go, ugh.
I think there's a lot of the items that you touched on that we're aware of at different times of the day or times of the month, you know, as you go through your practice, and it gives you a good outline of what to go back to and look at in your practice.
So,
You just outline everything that you may or may not be aware to look at or you go back to.
so what the participant was saying is that it was a good outline to go back, an overview to what to look at, because they may have all these components, but they may not necessarily be all listed together.
Or may have some of them and then look at others that we don't have.
Or they may have some of them, but not all of them.
Lots of good information.
Thank you. Good. Anything else? Okay, so now you're all ready for a break. So the break is from 3:30 to 3:45, and then you come back in here for Leadership Matters, okay, at 3:45, and that session goes to 5:15. Thank you all very, very much.